The moment a dog's teeth sink into human skin, everything changes in an instant. What may look like a small wound on the surface can trigger a dangerous chain reaction deep inside the body. Dog bites are not just painful injuries. They are medical emergencies that can lead to severe infections, permanent damage, and even death if ignored. When a dog bites, the first thing that happens is mechanical trauma. The dog's sharp canine teeth puncture the skin, while the powerful jaw muscles apply crushing force. Unlike clean knife cuts, dog bites tear and crush tissue at the same time. Skin, fat, muscle, blood vessels, and even nerves can be damaged within seconds. As the skin breaks open, blood immediately begins to flow. The amount of bleeding depends on the location and depth of the bite. Bites to the hands, face, neck, or legs can bleed heavily because these areas contain many blood vessels. Pain signals travel instantly through the nerves, sending shock-like sensations to the brain. The body reacts with fear, adrenaline, and panic. But the real danger begins after the bite. A dog's mouth contains hundreds of species of bacteria. These bacteria enter the wound the moment the skin is broken. Common bacteria include Pasteurella, Staphylococcus, Streptococcus, and Capnocytophaga. Even a bite that looks small on the outside can trap bacteria deep under the skin, creating the perfect environment for infection. Within a few hours, the area around the bite may start to swell, turn red, and feel warm. Pain increases instead of decreasing. This is the immune system responding to invading bacteria. White blood cells rush to the site, causing inflammation. Pus may begin to form as dead cells and bacteria accumulate. If the wound is not cleaned properly, infection can spread rapidly. The bacteria can move into surrounding tissues, causing cellulitis, a serious skin infection that spreads like wildfire. Red streaks may appear traveling up the arm or leg, a sign that infection is entering the lymphatic system. In severe cases, bacteria can enter the bloodstream, leading to sepsis, a life-threatening condition. Sepsis causes high fever, rapid heartbeat, low blood pressure, confusion, and organ failure. Without immediate medical treatment, sepsis can be fatal. Another major danger of dog bites is rabies. Rabies is a viral disease that affects the brain and nervous system. It is transmitted through the saliva of infected animals. If a rabid dog bites a person and the virus enters the body, symptoms may not appear for weeks or even months. During this silent period, the virus slowly travels through the nerves toward the brain. Once rabies symptoms begin, such as fever, anxiety, hallucinations, difficulty swallowing, and fear of water, the disease is almost always fatal. This is why rabies vaccination after a dog bite is critical, especially if the dog's vaccination status is unknown. Dog bites can also cause serious physical damage beyond infection. Bites to the hands can damage tendons, making it difficult or impossible to move fingers. Facial bites can result in permanent scarring or disfigurement. Bites to children are especially dangerous because their skin and muscles are more delicate. In some cases, nerve damage occurs. This can cause numbness, tingling, weakness, or loss of sensation around the bite area. Nerve injuries may take months to heal, and some may never fully recover. There is also the risk of tetanus, a deadly bacterial infection that affects the nervous system. If a person is not up to date on their tetanus vaccination, a dog bite can introduce the bacteria into the body, leading to painful muscle spasms and breathing difficulties. Psychological trauma is another hidden consequence. Many dog bite victims develop fear, anxiety, or post-traumatic stress disorder, PTSD. Children, in particular, may develop a lifelong fear of animals after an attack. Nightmares, flashbacks, and emotional distress are common after severe bites. Immediate first aid plays a crucial role in survival and recovery. As soon as a dog bite occurs, the wound should be washed thoroughly with soap and clean water for at least 10 to 15 minutes. This helps remove bacteria and saliva. Bleeding should be controlled with gentle pressure. The wound should never be tightly closed at home, as this can trap bacteria inside. Medical attention is essential, even for small bites. Doctors may prescribe antibiotics, administer rabies post-exposure vaccines, and give a tetanus shot if needed. Deep or severe wounds may require stitches, surgery, or hospitalization. Recovery time varies. Minor bites may heal within a few weeks, while severe injuries can take months and may leave permanent scars. Infections can delay healing and increase complications if not treated early. In the worst cases, untreated dog bites have led to amputations, permanent disability, and death. What begins as a single moment of aggression can change a person's life forever. Dog bites are not just accidents. They are medical emergencies that demand immediate attention. Understanding what happens inside the body after a dog bite can mean the difference between a quick recovery and a lifelong consequence. The lesson is clear. Never ignore a dog bite, no matter how small it appears. Because beneath the surface, the real danger may already be spreading.